Jean. Hi, my name is Danica. I'm a Douglas College nursing student. I'm going to be your student nurse today. Can you please state your name and your date of birth for me?
My full name is Soft Whispers, January 1st, 1968.
Do you have any allergies?
No.
Okay, I'm just going to take a look at your IV and your IV bag. So we have normal saline running at 30 mils an hour to keep the vein open. Looks good, no kinks. Just going to check your site. Do you have any pain here?
No.
Okay, it's free from redness and swelling, and it looks patent, and everything is running. Okay, I'm just going to put the vitals machine on, do your vitals. Okay, so today we're going to be giving you furosemide. Have you ever taken that medication before?
No.
Okay, well, furosemide is for your heart failure, and it's going to help with your hypertension and edema. And it's going to cause you to pee a lot, okay? And some possible side effects that you could experience after giving it is lightheadedness, dizziness, blurred vision, nausea, or vomiting. So I'll be with you for the first 5 minutes, but after that, please use your call bell to call me if you are experiencing any of them, okay?
Okay.
Okay, thank you. I'll be back with your medication.
Okay.
So as part of my check before I give the medication as well, I'd be assessing for ins and outs, daily weight. I'd be doing the blood pressure and pulse. I'd also be doing electrolyte levels, so checking her lab levels. If they're out of range or if they're in range, they should be, then it's fine to give. And I also want to check the renal panel function to make sure her kidneys are functioning properly. So first I'm going to check the physician's order just to confirm with the MAR that I have the correct order. Now I'm just going to look at the order on the MAR for furosemide. I'm just going to gather all my equipment. So I have furosemide right here. We're going to check for the right patient, so Soft Whispers, the right drug, furosemide, the right route, which is IV, the right dose, so 40 mg, so there is 4 mils in here, and it is 10 mg per mil. The right frequency and the right time, so it is at 4 o'clock, and we are giving it due to his congestive heart failure. So I'm also going to grab the PDTM just to make sure I am doing it right. So we're giving it IV direct. It is compatible with normal saline, and it is 40 mg per minute. So the dose is 40 mg, and I'm going to be giving 4 mils of furosemide because it is 10 mg per mil, so that's 4 mils. And my Q 15 seconds is I will be giving 1 ml per Q 15 seconds. Okay, moving on, we are going to now draw up the medication. So first things first, I'm going to alcohol swab the lid to make sure it is clean. Let that dry. Take out all my equipment. So I have my plunger and this. We're just going to put this on. Okay, now that we have it on and the alcohol has dried, since we're doing it into a vial, I'm going to inject air into this. So I'm going to pull the plunger down to 4 mils. So that's the amount of air I will be doing. And I'm going to put it into the vial just a little bit and then inject the air. I'm going to turn it upside down and start to pull back the med. So I'm going to just draw a little bit past and then draw back up to 4 mils. Now, I have a little air bubble in there, but I will get that out. And I'm gonna safely cap my needle. Now, I'm just going to bang it on the desk just to get out the air bubbles. Make sure all the bubbles are gone. No bubbles. After this, after I have my medication ready to go, I'm going to now label my medication. So we have the patient's name, so soft whispers, and this is furosemide, and it is 40 mg per 4 ml, and I'm just going to put 1 ml per 15 seconds just so I don't forget. And this is my name, just to make sure I added it. Now I'm going to be putting on this, but not where the numbers are, so I can actually see what I'm giving. So after that is done, I'm going to do my second check. So we have furosemide, yep, in here, furosemide, got it, 40 mg, it is IV. Right time is 4 o'clock. We're giving it for congestive heart failure. It's the right patient. And the frequency, we're just giving it once. That's all we know. So we are going to prime the saline flush just before we go into the room. So I'm going to open it. Now what I'm going to do is I'm just going to crack it open a little bit, push back just so there's a little bit more resistance. My instructor taught me to hit the bubbles so they're up, and then push it up until we see a little fluid. There we go. It is primed and it is ready to go. So I have my IV medication and my flash ready. And my MAR. We're gonna circle the time. Hi, Miss Whispers.
Hi.
How are you?
Good.
Can you just state your name and your date of birth for me?
Soft Whispers, January 1st, 1968.
Okay, so I have that for furosemide drug I was talking to you about earlier. I'm just going to do my last medication check.
Okay.
So, we have the right patient. We have the right medication, furosemide. We have the right dose, 40 mg per 4 ml. We have the right route, IV. Right frequency is once, and the time is 1600, and it's for her congestive heart failure. So I'm just gonna put that down. Okay, so I'm just gonna do a little quick site source check just to make sure your IV is good. So looking at the site, do you have any pain still?
No.
Okay, no redness, no swelling, and it looks patent. And so since the solution is compatible, if it wasn't compatible, I would have to flush before I give the medication and after I give the medication. As well, if this was a saline flush, I would have to flush before and after. And when it's not compatible, I flush with 10 mils before and after. And with a saline flush, it's usually 3 to 5 before, and however many mils the medication was after. Okay, moving on. Just gonna get my equipment ready, and I'm gonna pause the IV, and I'm gonna do hand hygiene, and then I'm gonna put on my gloves. Okay, so I'm gonna open up my alcohol swab and get this out and clamp it like this, and alcohol swab. Good. Now I'm just gonna get the medication. So we are administering 4 ml, so it's 1 ml per minute. So I will be using my little watch there to time myself. So I'll be putting this on, and I'm gonna get it to where I can see it, just so I know. And I'm gonna wait until it hits the 15, just so I know when to start my administration. Okay, so we are doing 1 ml right now. And I have to stop and wait until it hits 30. And we're gonna do the other ml right now. And stop at 2 and do our another ml now. And stop until it hits. And do our last ml now. And now I'm going to disconnect the medication, and I'm going to pull out my flush. So I'm going to put the flush in there. And with the flush, we're going to do 4 mLs in 1 minute. So I'm just going to wait until I see it hit the 45 and then start. So I'm going to start now. 1 ml. And stop and wait. Then I do the other ml. And stop and wait. Then I do the other ml. And stop and wait. And the last ml. And that is the last ml in 1 minute, 4 mLs in 1 minute of the flush. And then I'm going to let the IV run back at normal saline, 30 mils per hour to keep the vein open and running.
Thank you.
No problem. So again, if you have any of the side effects we talked about earlier, please let me know. I'll be here with you for the first 5 minutes, but after that, please let me know via your call bell. I'm going to discard these in the garbage, and I'm going to sign that I gave my furosemide 40 mg per ml at 1600